With EOBS, we've rolled it out to our inpatient units, so we're step-down care. We've got 4 primary sites, about 20 wards across those sites, and we've rolled EOBS out as a solution for our HCAs and nursing staff on the wards. We've had issues around digital innovation and uptake with our HCA staff where they're technically disadvantaged. With EOBS, we've developed the product quite a lot internally, so we don't just use it for News 2. We've got about 40 forms that we use on EOBS, so anything that the nursing staff are doing directly at the bedside, they can now record on EOBS at point of care using the iPads that they have available to them on the wards. The beauty of the data being able to be transferred directly back into the RIO record, providing that seamless record, is essential to what we're doing. But yeah, it's gone down really well. We've had fantastic uptake. We did a lot of work when we initially rolled the system out around usage of forms, and sort of fed that back to the wards and the different professional groups that were using the system to aid uptake and improve engagement, and that's made quite a difference as well. Social prescribing as an entity has been something that I think we've always done in the background. As a community trust, a big part of what we're dealing with are social issues and enabling patients within the community to access things that are actually available to them. A lot of that has happened under the radar in the past. Elemental brings that ability to not only monitor what patients have been given access to, but also their uptake and the outcomes of their intervention via the social prescribing. As an organisation or as a ICS, we're just at the early stages of the rollout for Elemental, and we're doing it at an ICS level. So we're looking at it being available via our shared care record, as opposed to just within the GPs or within the community services. So bringing that together as a whole for multiple providers to know what has been proposed, what has been suggested for an individual and what their uptake has been, is going to be really quite new and transformational in terms of how we work. A lot of our community services going out to homes are involved in signposting patients and families to different providers, external providers that could help support them in the home setting. But it's always been very much what you know as an individual. So having Elemental in place almost gives that dictionary data set of what's available and levels the playing field a bit in terms of what can be offered. Okay, so in terms of next steps, we're obviously a step-down service. So for us, we've got UCR, so urgent care response. We've got EICT, early intervention, early discharge, prevention, admission avoidance. We have to link very much in terms of what the ICS is doing around virtual wards. So all of those things are huge pieces of work for us as a community organisation. Our UCR at the moment are doing a lot of work to take the low-level 999 calls off the ambulance service. So they're doing the 2-hour response work, the virtual wards, and sharing the information between health and social care is key in a lot of that work. There's that ability to share information between social care and health and provide the right input at the right time. Having the ability to cancel services if somebody is admitted. All of those things coming together are very transformational in terms of NHS care and social care going forward. But yeah, the virtual wards is definitely a big thing across all the ICSs at the moment.